the CDC is under fire for failing to publish a large portion of data related to the COVID-19 pandemic. The story was first reported by the New York Times. It says the agency has held on to critical data about hospitalizations in the United States, broken down by age, broken down by race, and by vaccination status. More so, it says CDC data published 2 weeks ago on the efficacy of booster shots neglected to include numbers for Americans younger than 49. Apoorva Mandavilli has been reporting on this for the New York Times, and she joins us now with more. Thank you so much for joining us. This was a fascinating report. Explain to our audience, Apoorva, why has the CDC only published a fraction of the data that it's collected?
Well, as you can imagine, the CDC is a huge public health agency, and they have been tracking the pandemic right from the start. So they have all kinds of data. And my reporting has uncovered just this little part that they haven't shared. I don't know what else they're holding on to. But these data are quite important. As you mentioned, they're holding on to hospitalization data. What the CDC has done is told people, if you're vaccinated, you are at X relative risk lower than somebody who's not vaccinated. But it turns out that ever since vaccines were rolled out last year, they've been collecting information on who is in the hospital any given week by age, race, sex, and most importantly, by vaccination status. And so this would have told us a lot about the risk of somebody who is vaccinated and boosted versus somebody who is not.
So what's some of the other sort of timely data that they've been holding on to? I find the wastewater one particularly interesting, but I'm sure you've got some really fascinating stuff.
The wastewater data is another really interesting one, and it's an easy one because it essentially means that they're looking in sewage at a signal for the virus. And a lot of communities across the country have been collecting these data for the last year and a half, almost 2 years now, and they've been sending it to the CDC. But what I've heard is that the CDC is reluctant or has been reluctant to make these data public because wastewater data is new to the agency. And CDC scientists are by nature quite conservative. They move slowly. They want to be absolutely sure what they have before they make it public. And so they've been a little slow in getting those out. They've also been slow in getting out booster data, showing people exactly who, by age, which people have gotten boosters and how much that protects them. That data is actually out now. Ever since my article came out, we've discovered that actually the CDC did post it Thursday night after many, many queries from the New York Times. So this is, a bunch of different streams of data that they've been holding on to.
Yeah, what's I think going to be challenging is that a number of Americans already have problems trusting the CDC, trusting health officials in this country, Apoorva, as you know. And so, this just adds to the confusion, the lack of trust that citizens have in our public health officials. So explain what kind of bureaucratic roadblocks CDC officials encountered that prevented them from publishing this performance data on vaccines and boosters, especially in the younger children.
The CDC is just one cog in a very big government machine, and the CDC is managed by the Department of Health and Human Services, along with the FDA. And it's a huge organization in itself with many, many divisions. And generally, when the CDC puts out something, they like to send it to all the divisions in the agency that have anything to do with that, to all their state partners. They alert the Department of Health and Human Services. They alert the White House. Those are a lot of steps that add up to delays. There have been good reasons for why they've had to do that, but it does mean that we get the data a lot more slowly than we should.
What I find sort of interesting about your article is, to me, this is sort of an ongoing theme or a pattern, right? When we think back to the beginning of the pandemic, this was some of the criticism that the CDC was the only place you could get samples tested, and they were overwhelmed. They didn't know how to handle it. They had a test that didn't really work properly, and it really sort of messed up the way we dealt with the pandemic in the very beginning. So now you have a CDC that's collecting all this data. They don't really know how to handle it, what to spit back out to the general public. I'm wondering, how is the CDC justifying this?
The CDC is a very old agency, and what they told me is that their systems are very old. As you mentioned, at the beginning of the pandemic, it was utter chaos in some ways. And part of that was that cases from the states were being sent to the CDC in spreadsheets and, being called in. They're not very up to date and modern in their systems. So they've now received more than $1 billion to modernize some of that infrastructure, and they hope to build data systems that are a little faster. But what I've also heard, is that the CDC is such a big agency and there are reasons for them to be careful. But maybe because they are so big, it's just not possible for them to be nimble and fast in a situation like this, like they need to be. It may need a completely different way of thinking about public health.
Yeah, I think that is one of the conclusions that we're coming to, that the CDC is really not equipped for an extended campaign like this, right? To deal with a pandemic. They can deal with smaller things. Their job has always been to collect data.
Right.
But in terms of sort of rolling out a campaign to tackle a pandemic, that's not what they're supposed to be doing, and that's what they were tasked with doing.
When that information is critical for people, when you're asking them essentially to disrupt their entire lives over the course of 2 years. And the question, I guess, my final question, Apoorva, would be, what about funding? Because a lot of what we're seeing, I mean, remember back in 2014, there was President Obama and Vice President Biden then said, look, we've glimpsed a little bit of what it could be like if we're battling a pandemic when it came to Ebola. So let's put into place measures and, a system that will allow us to deal with the real pandemic when it comes along. We're not really seeing that yet. So I don't want to be here in 5 years because, look, every public health official and scientists say we're going to be in this situation again with something else down the line. Don't want to find ourselves 5 years from now with another pandemic and the CDC saying, hey, we're not properly funded or we don't know what to do.
But I think, Apoorva, you'll probably say, I don't know, but that's not what the CDC was ever sort of intended to do. So I don't know if it's about funding or if it's about a whole new organization or an overhaul of the CDC to equip them to take on these sort of challenges.
Maybe like the United States created the Department of Homeland Security, Apoorva. After 9/11, you needed a whole different infrastructure, a whole different bureaucracy to handle something like that. I don't know what you're learning from your sources.
Well, the CDC has done this kind of work abroad. They haven't always done it in the United States because we haven't had epidemics of this scale. But this is something they have done in other countries. It just seems, as you said, that they haven't been able to sustain that level of engagement with the public and so many eyes on every decision they make for this long a period of time. Reporters don't normally go to every internal CDC meeting about vaccines as we have been. So I think this has been a big wake-up call for the agency in many ways. And to be fair, they are trying to adapt. They have gotten money and they are trying to modernize. There are also some problems, though, with how our government is set up in terms of what data the states are willing to give the CDC. The CDC's hamstrung in some ways. But I do also hope that some of the money goes to communication, because I think one of the big problems that I've been hearing about here is that the CDC didn't want to get some of these data out because they were worried that it would be misinterpreted. And all the experts I spoke to said that is a terrible reason, because when you hide data or when you keep data from being released, it actually breeds more mistrust.
Yes, and leaves an opening for misinformation, which we've basically been talking about for 2 years. Apoorva Mandavilli, thank you so much.
Sure.